Fractional exhaled nitric oxide, or FeNO for short, is the small level of nitric oxide that your body breathes out, which can be measured to aid in management and diagnosis of asthma. Your body produces nitric oxide, or NO, naturally to combat inflammation, and airway inflammation is a central process in asthma and other lung diseases. Therefore, FeNO can be used as a non-invasive biomarker of airway inflammation to help differentiate between allergic and non-allergic asthma, as well as between asthma and other respiratory conditions. The NObreath, a handheld FeNO monitor, which is recommended by NICE and conform to ATS and ERS guidelines. The NObreath makes FeNO monitoring quick and easy, plus it's completely non-invasive, with the ability to monitor airway inflammation in both adult and child patients. Furthermore, the ambient monitoring mode enables you to check ambient levels of NO. The NObreath has an inbuilt demonstration video of the breath test process. We recommend watching this video prior to using the device for the first time. This demo can be used to explain to patients how the test will run prior to performing one. The demo video can be accessed from the home screen by pressing the Play Demo icon. Select either the adult or child breath test icon and a demonstration will begin at an accelerated speed. Press the home icon at any time to exit the demonstration mode. The NObreath is capable of storing up to 50 patient profiles. From the home screen, press the Profiles icon to access the list of patient profiles. If you have not entered your PIN in the last 30 minutes, you will be asked to enter it before you can access this list. Select the patient you wish to view. From a patient's profile, you can view a graph of results, take a new breath test, or delete their profile. To create a new profile, choose an empty profile slot and use the keypad to enter a name or reference. Then press the Save icon to save the new profile. To edit a patient's profile, select them from the list and then select their name again. Use the keypad to edit the profile and press the Save icon to keep the changes or the back arrow to cancel. To delete a patient's profile, select them from the list and, once in their profile, press the red X. Press the tick to confirm that you wish to delete the patient or the back arrow to cancel. Press Home to return to the main screen. To take a breath test, click on either the adult or child icon and attach a new mouthpiece to the unit. If needed, the test can be cancelled at any point by clicking the home icon. Take a deep breath, and when the exhale icon appears, keep the monitor upright and blow gently into the mouthpiece, making sure you do not cover the vent holes. The on-screen flow meter will guide you on the exhalation rate. Continue blowing until the green tick appears on screen to signify a successful test. If you blow outside of the exhalation guidelines, the test will beep, signifying a fail, and a red cross will appear. Either press the retry icon to take the test again, or the next icon to view the results anyway. You can press the home icon to return to the main screen, or you can save this result by pressing the save icon. If you choose to save your results, you'll be asked to enter your PIN if you haven't entered it in the last 30 minutes. Select a profile from the list to add your result to, or select an empty slot to set a new one. Readings and results can be interpreted using the NObreath FeNO interpretation chart. Each device will automatically be preset to the PIN code 0000. It is highly recommended that you change this PIN to a 4-digit number that you will remember. To change the PIN, press the PIN change icon from the settings menu and you will be prompted to enter the current PIN. Enter your 4-digit code and press Next to continue. Enter a new 4-digit PIN and press Next to continue. Re-enter your PIN to confirm the new 4-digit code and press the tick to save. If at any point you change your mind, press the back arrow to return to the previous screen or the home icon to return to the main screen. The NObreath FeNO monitor comes with a dock and charging cable to keep your monitor at hand and fully charged. To charge the NObreath, first make sure that the docking station is connected to the mains using the charging cable provided. When it is receiving power, the green LED will light up and you may place your NObreath in the dock to charge it. The NObreath FeNO monitor comes with free patient management software, FeNOchart, allowing you to keep patient profiles, capture live readings, plot graphs, print reports, and much more.